Hello everyone, my name is Linfield West Boston. I'm a student of the QualiTest Medical Laboratory and Allied Health Training Institute. My lecturer's name is Miss Yvette Irvin, and this is my phlebotomy video. The purpose of this video is to outline the functions of a phlebotomist in delivering quality patient care and to establish procedures done routinely by phlebotomists. Phlebotomy is the process of making a puncture in the vein for the purpose of drawing blood for medical or clinical testings, research, donations, or transfusions. The process itself is known as venipuncture, and it could also be collected by using finger sticks and heel sticks from infants. A person who performs phlebotomy is known as a phlebotomist or a phlebotomy technician. These professionals can be found in all different types of healthcare facilities, including doctors' offices, long-term care facilities, outpatient care centers, and hospitals. A phlebotomist facilitates the collection and transportation of laboratory specimens and may also be involved in patient data entry. They are oftentimes the patient's first and only contact with the medical laboratory. Some equipments and supplies routinely used by phlebotomists are phlebotomy chairs, trays, carts, 70% isopropyl alcohol swabs, gauze, tourniquet, needles, which we have our hypodermic needles, our multi-sample needles, and our wing infusion sets, better known as butterfly needles. We'll touch more on those later on. We have our face mask, we have our gloves. We also have our tubes, evacuated system tubes. We have our biohazard bags, our biohazard containers, sharps containers. We have our disposable gowns, we have our lab coats, we have our lancets, we have our watch, our pens, and so on. Now we are going to look at the sites for venipuncture and skin puncture or capillary sticks. As I mentioned earlier, phlebotomy is the process of making a puncture in the vein for the purpose of drawing blood, and this process is usually done on the arm. The antecubital fossa is a shallow depression in the arm that is anterior or in front of and below the bend of the elbow. It's a first choice location for venipuncture because several major arm veins lie close to the surface in that area, which makes them easier to locate and penetrate with a needle. These veins are called the antecubital veins. There are three major veins located in the antecubital area, which is more suitable for venipuncture. We have the median cubital vein, which is located near the center of the antecubital area and is usually the first choice vein for venipuncture because it is typically larger, it's closer to the surface, and easier to anchor. Then we have the cephalic vein, which is located in the lateral aspect of the antecubital area. It is a second choice vein when performing venipuncture. This vein is often harder to palpate than the median cubital, but is fairly well anchored and often the only vein that can be felt in obese patients. Then we have the basilic vein, which is located on the medial aspect or the inner side of the antecubital area. It is the last choice vein for venipuncture. It is generally easy to palpate, but is not as well anchored and rolls more easily, which increases the possibility of accidental puncture of the median nerves, which is a major nerve vein. Veins on the back of the hand and wrist or your dorsal forearm are also acceptable for venipuncture. Veins on the side of the wrist above the thumb should not be used as nerve injury could occur in these areas. Now we'll have a look at skin puncture, also known as dermal puncture or capillary puncture. This is a blood sample collected from a puncture on the finger, the heel, or an earlobe. It is less invasive, requires a small amount of blood volume, and can be performed quickly and easily. This technique has become more popular with the widespread use of point-of-care testings. Skin puncture instead of venipuncture can be especially important in pediatric patients to avoid blood reduction and the risk of anemia. It is also recommended for adult patients with severe burns, those who are obese or older, those with fragile veins, and those who self-test their blood, such as glucose testings. Recommended Skin puncture sites are the finger for adults and older children and the heel of infants and younger children. It must be on the palm-up surface of the distal segment of the middle or ring finger, and it should be made perpendicular or across the fingerprints, not parallel to it. Capillary sampling should not be performed in the smallest finger because tissue depth is insufficient to prevent bone injury, or on the thumb or index finger because they are more sensitive than the others. When performed on the infant's heel, the medial or lateral plantar surface of the heel is the preferred puncture site. Capillary sampling should never be performed on the posterior curved part or the central area of the infant's heel because of greater risk of injury to nerve tendons or cartilage. As mentioned earlier, there are three types of needles when performing a venipuncture. We have our hypodermic needles, we have our multi-sample needles, and we have our ring infusion set or butterfly needles as mentioned earlier. First, we're going to look at our hypodermic needles. These needles goes with what we call the syringe system. This method of venipuncture is normally used for patients with small or difficult veins. Needle gauges varies, but the standard needles for venipuncture on normal veins are our 21 gauge needles. The 22 gauge needle is preferred for older children and adults who has small or difficult veins. The syringe system is also preferred for the elderlies whose veins are easily collapsed. Now let's look at the parts of a hypodermic needle and syringe system. To the tip, we have the bevel. This is where the blood flows through. Always ensure that the bevel side is facing upwards when performing a venipuncture. The long cylindrical part here, this is called the shaft. And the end that is attached to the syringe is called the hub. There are various sizes of syringes, but the most common volumes or sizes used for venipuncture are 2, 5, or 10 ml syringes. Syringe volume is selected according to the condition and the site of the patient's veins, also the amount of blood needed. This is the part of a syringe system. We have the barrel here, and this is the plunger. Always remember to remove air from the syringe before performing a venipuncture because we do not want air to enter the patient's vein, because air bubbles could travel to the patient's brains, heart, or lungs and cause respiratory failure, stroke, or heart attack. Blood collection in a syringe must be transferred into ETS tubes. We'll speak more on this later. This is done by using a syringe transfer device. A transfer device must be held vertical when tubes are being filled to prevent contamination of the specimen. Then we have our multi-sample needles, which allows us to fill multiple tubes of blood during a single venipuncture. These come with color-coded caps and also color-coded hubs, and they vary in sizes. 21 gauge is the standard size for venipuncture with normal veins. Like a hypodermic needle, there is the bevel to the top, we have the shaft, and we have a threaded hub, which is used to attach to the holder. Then we have our tube. Then we have our winged infusion sets or butterfly needles. These needles comes in various gauges and is used on hand veins and veins of elderly and pediatric patients. 23 gauge is the most commonly used. Winged infusion sets can be used with both ETS vacutainers and the syringe system for specimen collection. Now we'll have a look at our vacutainer tubes, also known as our evacuated tube system. These are the tubes that's transported to the laboratory with your specimens for testing. They all have different color stoppers and they all have different functions and goes to different departments. The type of tubes or additive required for blood collection depends on the type of test ordered. There is also a sequence to follow, which is known as the order of draw. This helps to minimize contamination of the specimen. First, we have our blood culture vials, which are aerobic and anaerobic. These are used to detect the presence of bacteria and other microorganisms in the blood. These testings are sent to the microbiology department. First, we have our light blue stopper tubes containing the additive sodium citrate. Sodium citrate helps to prevent coagulation by binding or chelating calcium. Some common tests done in this tube are our PT-INR, PTT, or D-dimers. This tube is sent to coagulation department and is usually drawn first because other additive tubes affects coagulation testings. Next in the order of draw, we have our red tube stopper, or as we call it, the non-additive tube. There is also serum separator tube, which has a clot activator called silica. These tubes are normally sent to serology or chemistry department, and a common test done in this tube is our PSA, which is our prostate specific antigen testings. Then we have our light green tube stopper, which contains heparin. Heparin prevents clotting by inhibiting thrombin. There are three formations of heparin, and these are ammonium heparin, sodium heparin, and lithium heparin. Lithium heparin is the most widely used anticoagulant for plasma and whole blood chemistry tests. Stat electrolytes is a common test done in heparin tubes. These tubes are sent to your chemistry department. Then we have our lavender or purple top tube stoppers. This tube contains an anticoagulant called EDTA and is usually used for whole blood testings. EDTA prevents coagulation by binding or chelating calcium. A common test done in this tube is called CBC, or our complete blood count, and this tube is sent to your hematology department. This tube is also responsible for more carryover problems than any other additive tubes, and this is why it's drawn last unless there is an order for a gray top tube. Then we have our gray top tube stoppers, which contains potassium oxalate or sodium fluoride. It prevents clotting by binding and precipitating calcium. Some common tests done in this tube are our glucose testings or blood alcohol or lactic acid testings. This tube is sent to your chemistry department. The order of draw for collecting multiple samples for capillary puncture is not the same as the order of draw for a venipuncture. When puncturing the skin, the coagulation process in the blood activates quickly, and so specimens must be collected quickly to minimize the effects of platelet clumping. Because of this, hematology specimens are collected first because they are most affected by the clotting process. This is our purple top tube stoppers containing EDTA. This is then followed by other additive testings or other additive tubes such as our heparin tubes and so on. Collect serum specimens last because these testings are supposed to clot. Components of a phlebotomy tray. Components of a phlebotomy tray depends on the type of hospital or laboratory the phlebotomist works in. This may include our alcohol swabs, or we may have iodine for our blood culture collection. We have our gauze. This is to apply pressure on the venipuncture site to prevent hematoma. We have tape. We have our evacuated tubes. We have a tube holder. We have our syringes. These are our hypodermic needles are attached to the syringes. We have our multi-sample needles, tourniquet, micro collection tubes and lancets, gloves, and our sharp containers. Steps for a routine ETS venipuncture. Review and accession test requests. That includes date and the time of collection, status, and priority. Identify and prepare the patient. Verify date of birth and explain the procedure to the patient. Verify diet restriction and latex sensitivity. Sanitize hands and put on gloves. Apply tourniquet 3 to 4 inches above the antecubital area. Ask patient to form a fist so veins are more prominent and easier to palpate. Select the vein, release tourniquet, ask the patient to open fist and clean the venipuncture site in concentric circles. Prepare equipment while allowing the site to air dry for 30 seconds to a minute. Attach needle to ETS holder and insert collection tube. Avoid puncturing the tube. Reapply tourniquet, uncap and inspect needle for defects. Ask patient to remake a fist, anchor the vein and insert needle. Bevel up, as stated earlier. Establish blood flow by pushing tube completely into the needle with your thumb. Blood should flow into the tube until vacuum is exhausted. Remove the tourniquet and ask patient to open fist. Ensure all tubes are filled in order of draw and mix immediately upon removal from holder. Place a gauze over venipuncture site and remove needle. Activate safety feature to prevent needle stick and apply pressure to the site. Dispose sharps in sharps container. Label tubes and observe special handling precautions. Check patient's arm for signs of bleeding and apply bandage. Dispose of other used and contaminated materials. Thank the patient, remove gloves in an aseptic manner and wash or sanitize hands. The same steps should be followed when using a needle and syringe system. However, release air from syringe before penetrating the vein, and blood is filled into the syringe by slowly pulling back on the plunger. Remove needle and discard. Then attach a transfer device to the syringe for filling the tubes. Follow order of draw. For a venipuncture on hand veins, using a butterfly and ETS holder, the tourniquet is placed proximal to the wrist bone. Anchor vein and insert needle at an angle of 10 degrees or less. Blood flows when needle pierces the tube holder. Follow order of draw. For pediatric venipuncture, children may be sensitive to pain and have a fear of needles or what is known as needle phobia. One way to gain that child's trust is by physically lowering yourself to the child's level and explain the procedure to them. It's important to also calm a crying child down as soon as possible because the stress of crying can alter blood components and lead to erroneous test results. Pain can be minimized by including the use of EMLA, mixture of local anesthetics, or oral sucrose and pacifiers for infants and toddlers. As stated earlier, 23-gauge butterfly needles is preferred for children and attempts should be made to collect the minimum amount of blood required for testings due to the small blood volume of the child. Follow previous collection steps as previously stated before. Finger and heel sticks. When selecting a site for capillary stick, it should be pink or normal color, free of scars, cuts, bruises, or rashes, and it shouldn't be cyanotic. Finger and heel sticks are done with lancets and shouldn't go deeper than 2 mm into the skin. Lower finger or heel to encourage blood flow. Wipe away the first drop of blood because it's typically contaminated with excess tissue fluid. Never milk or squeeze the site. Fill tubes in order of draw using micro tubes. When performing venipuncture, some problem sites to be aware of are damaged veins, which are sclerosed or clotted from the effects of inflammation, chemotherapy, or scarring caused by numerous venipunctures. Use another site if possible or draw below damaged veins. Then we have hematoma. Hematoma is blood leaking from a blood vessel during or following a venipuncture. Blood from a hematoma could be contaminated blood and should be performed on another site or distal to the hematoma. Another site to be aware of is persons with mastectomy. This is a surgical removal of one or both breasts. Blood should never be drawn from the same arm of a mastectomy. Blood composition could change and lead to inaccurate test results. Find another suitable site. There are some patient complications and conditions you could encounter during or after performing a venipuncture. One of this is excess bleeding. Some patients who are on aspirin or anticoagulant therapy may take longer to stop bleeding. Be sure to maintain pressure over the site until blood stops. Then we have nausea and vomiting. A patient may feel nauseous or show signs similar to fainting. Do not perform venipuncture until experience subsides. If already in progress, discontinue. Give the patient a basin or wastebasket to vomit in. Have them breathe slowly and deeply and place a cold compress to the forehead. Notify the appropriate personnel of the incident. Syncope, more commonly known as fainting. This is a loss of consciousness resulting from insufficient blood flow to the brain. Some patients faint from the sight of blood, and other factors such as anemia, dehydration, hypoglycemia, medications, hyperventilation, needle phobia, and so on. Patients should be asked prior to blood collection about history of fainting phobias and should be asked to lay down for the procedure. Should a patient faint during blood collection, release tourniquet, remove and discard needle as quickly as possible, apply pressure to the site, lower the patient's head and have them breathe deeply. Apply a cold compress or wet washcloth to the forehead or back of the neck. Call for first aid personnel if patient is unresponsive, and document the incident according to your facility's protocol. And we have reached the end of this presentation. If you or anyone you know may be interested in a career as a phlebotomist, call the number below and start your journey today. Thanks for watching.